We will begin with the incredible story of nurse Anne Montera, who will be joined on stage by her husband, paramedic Chris Montera. For the past 4 months, EMS World Magazine has profiled this incredible story. And this morning, you will get the opportunity to hear from them directly, including being treated to the amazing conclusion of their story. Welcome, Anne and Chris.
I'd like a show of hands. How many in the audience today are experiencing pain today? You woke up with it, you have it right now. Come on, I know people are out there. Show me your hands.
Hi.
Awesome. Have you been having that pain more than 1 week? Keep your hands up. Yes. How about a month? Have you been having it a month? Okay, how about 3 months? If you still have your hand up, congratulations. You have chronic pain. And as a paramedic, I was often taught that pain can't kill you. Pain, it's just in your head. It's a symptom of something that we can see, but it's really not there. And you're a nurse. Did you ever tell a patient that?
You know, as an OB nurse, I never told a patient that they weren't in pain. I taught them how to breathe through their pain, and not just once, one incident, but for every contraction for hours and hours and hours on end. The other thing that I would do is I would teach the dads how to breathe through pain, just in case if during one of those contractions, the mom is reaching for whatever she can grasp to get through that contraction, that the dad may need to use some breathing techniques to survive that one.
Well, you are mean. Okay, I do agree with that. So I've often told patients that oxygen can help their pain. Has anybody ever told them that?
Well, and I know of a common pain, a pain that every mother has experienced. The pain of being pregnant, the pain of childbirth, but I'm telling you that every single second being pregnant and every single minute of that labor was so worth it. I also know of a different pain.
Ow.
So
did you breathe through that one too?
A lot of breathing. This isn't me, but with 15 years of playing volleyball, I did this exact injury. And I'll tell you, it's excruciating. I even watched the video now and I can feel the pain just go through my entire body. But in doing that, it was 26 years ago and 4 surgeries later, but guess what? I still can wear my sexy heels.
Very nice. So we know that pain is different between men and women, and there is some research out there that shows that pain in us is as simple as the sex hormones we're born with.
So let's get this straight. So women, men, different. So when you have your cold and you're sick and you have your sore throat, and you're at home in bed with your man cold, and then I have the exact same cold and I need to go out and be super mom and don't even get to go to bed? Is that what it means, the difference?
Really? All right.
Okay. Just checking. I do know of this other type of pain. It's that chronic pain where I had to personally deal with having that impact of that pain and affect me each and every day. It was when I could finally convince the surgeon to go explore what was going on in my body, this is what they found. I was diagnosed with endometriosis. I had so many adhesions that my gallbladder was attached to my small intestine, and they had to remove my gallbladder with that first abdominal surgery. But with all of that, over 20 years, over 20 doctors, and through all of that, I was still working as a nurse and maintaining being a mom and a professional. But then, with all of just that, and you would think if they saw that inside of me, they would acknowledge my pain, but still this healthcare system made it feel like it was always just in my head, like almost like I was going crazy.
Well, you are crazy. I'm just saying.
I'm crazy, I married you.
Well, that's true. Okay. All right.
I'm a crazy paramedic. Well, with all of this and over all of these 20 years, they also gave me all of these different medications. I had medication after medication. I had to deal with what life would be like on the medications, the side effect of the medications, and they would just keep coming and going. It was just such a struggle when I would do this. I even often had times where I was kind of pushed away at work and I wasn't supported by acquaintances in our community. And I was even told, I do not understand how you could be harming yourself and your unborn child taking all these medications and you're doing that on purpose. People really could never imagine what this pain is. So over 20 years, over 20 doctors, and over 35 different medications. There is also, I remember this one day as if it was yesterday. I found that one doctor that looked at me and said, Anne, you have every right to hurt. Your pain is real. That day, I can remember that as if it was yesterday. He did exploratory surgery, and this is what he found.
It looks like he found Jupiter.
No,
Oh, apparently not. Okay.
not quite
okay,
Jupiter.
sorry.
I was diagnosed with interstitial cystitis, or they call it painful bladder syndrome.
Well, and when she was diagnosed with it, I didn't really understand it myself. But imagine the lining of your bladder as you get urine in your bladder all day long, and as you go to the restroom, those little tiny blood cysts in your bladder pop, and that causes tremendous pain. I don't know how you deal with it. I really don't. You're amazing.
Thank you, babe. I also found a doctor that was doing an experimental procedure of using a sacral nerve stimulator to be implanted. And what it would do and what it does is it redirects the pain receptors to my brain and tell me that I'm not in pain. So here, this is what it looks like. That was a couple surgeries getting that all figured out. The last thing I was diagnosed with was polycystic ovarian syndrome. And you're gonna see an ultrasound picture up here. I had large cysts on my ovaries. They diagnosed me when they had to remove a softball-sized cyst off of one of my ovaries. But over 20 years, over 20 doctors, over 35 different medications, and 20 surgeries. But leading up to this last one, it was the worst.
So, we rehearsed this a ton of times. It didn't ever get this painful at first. I'd never seen Anne quite like this last time. She would lay in bed for hours, and some days she wouldn't even be able to get her pain under control. Some days would be great, and she'd be able to do it, and Lyrica, fentanyl, oxycodone, hot packs, and Zofran, that was really her friends. Other times, she would lay in bed all day and then get this burst of energy in the evening. And I'd wake up and find her in the kitchen 1, 2, 3 a.m., cooking and cleaning the house without any memory of ever doing it. I'll tell you though, the house was never cleaner and I was never fatter because she kept baking all night long. So it was about 6 months it took us to find an OBGYN that would actually take a look at Anne and take her as a patient because of her complex medical history. He had arrived to the conclusion that Anne needed to have her ovaries yanked out.
Yanked, fun, yeah.
Well, okay,
yanked.
all right. Okay, so they had to be surgically removed and causing instant menopause. I'm
Fun.
She keeps reminding me of that. So the day of surgery came, and the surgeon came out and said it was very successful. He was able to remove the ovaries, found a lot more cysts in there, as well as endometriosis and some old staples from some old surgeries. And I thought, finally, relief. Relief for her, relief for us. We could have a normal life again. I always knew that the interstitial cystitis would be with us, but we can manage that. It's something we can deal with. So we decided we were going to move into our new house that same week. We don't ever do anything easy in our world. and it was the week of Christmas. And our friend Erin, who's in the audience with us, she came out and joined us. And we've helped each other move, oh boy, 4 or 5 times each. So that's really the sign of good friendship. And they were with us that whole week, just setting up the house, and Anne was still recovering from the surgery. The night of January 3rd, I went to bed early. And, Erin and Anne stayed up later to work on a project. About 12 o'clock midnight, I don't generally wake up at that time of night, but I did. And I woke up and found Anne sitting in this kitchen with kitchen towels all around her, crying in pain. So she was also complaining of nausea and that her ears were ringing. Earlier that week, I had refilled her prescription for fentanyl, and we knew we had her on a path to get out of her medication regimen. And the new fentanyl, it was a new manufacturer, so I picked her up, took her to bed. I said, honey, let me get you a hot pack. I gave her some Zofran, and I said, I'll be right back to hold you, because she was having a pain storm, obviously. I also removed the fentanyl patch. I had wondered if maybe that was the reason why her ears were ringing. 5 minutes. I was out of the bedroom 5 minutes. And I walked in and I had that feeling. You're a parent, you're a provider, you get it. You just know something's wrong. I went to her side of the bed and I didn't hear her breathing. I kicked on the light and there she was, blue, lifeless, staring at me, not there. At that point, I had been a paramedic and an EMT and an EMS for 28 years. I lost it. I really did. I lost all modicum of being a healthcare provider, and I started screaming. I did give her 2 breaths in the middle of that, though. Opened her airway, rubbed her chest. At that point, Erin, our friend, and our daughter, Emma, came into the room, and they helped me to the floor, to get her to the floor. I sent Emma out to my vehicle to get my AED and my medical kit, and we started chest compressions. At that point, Erin said, you know, you should probably call 911. I went, oh yeah, I probably should do that. So we did. They're trying to give me CPR instructions, and I was so frustrated. I just said, I gave my radio designation on the phone, and I said, get to my house, and I hung up the phone, and I grabbed my radio. 2 more breaths. We're still doing CPR. The AED arrived. We put it on. It didn't advise a shock, so we continued the CPR. That was the longest 6 minutes of my life. And I remember at one point I looked at Erin, and I was like, I can't believe I'm doing this to my wife. And at the same moment, I had the thought in my head that maybe we should just let her go. She wasn't in pain anymore. We should just let her die.
There is very little that I remember about that night. The first thing that I remember is my hand being squeezed. Later, I find out that was my daughter Emma holding my hand the entire time. The next thing that I remember was Chris yelling at me, and I couldn't figure out why the heck he was yelling at me. He never yells at me. Like, what did I do wrong? And then I remember, and I could smell that plastic oxygen mask on my face in this bright light. And with him yelling and the squeeze, that's what all was going on. There's very little that I continue to remember. I remember the paramedics arriving and them taking me to the hospital. I'm gonna say this anyway. I remember scolding them because they weren't belted in.
My paramedics remind me of that.
Yeah. So, but then just experiencing that, we thought that was the worst thing that we could ever experience, but what happened next was even worse.
So we followed her to the ER. We got there, and they said, we should admit her overnight. I begrudgingly agreed. I said, I guess we did do CPR on her. We should make sure everything's okay. Those days in the hospital became our prison, and we didn't realize it.
Again, not all of it is there or clear, but there are some very distinct things that I remember. I remember feeling like I was treated like an addict, like I had that scarlet letter tattooed on my chest. I remember them standing outside of my room giving report and hearing this at every change of shift. They would say, she's an addict, she's taking all of these medications, she probably tried to overdose, and then her husband had to save her and rescue her doing CPR. Oh, but wait, by the way, remember, he's the paramedic chief, so we need to be nice to her. I also then remember they started taking away all of my medications, over 75% just stripping them off without any medical assistance with that. And then I had a nurse practitioner come into the room, and she wanted to give me some advice on how to deal with my pain with alternative methods. She's like, honey, you're gonna need to start to drink some hot tea and use some heat packs. And I reached under my covers. I said, you mean like this one that I'm already using? I told her, I've been dealing with this for over 20 years. I know what to do and I know how to manage that. But I felt so isolated, so alone, and just still in such a large amount of pain.
I also remember at one point her blood pressure was 210 over 105, and a nurse came in and she was getting ready to inject her IV with some medication. I said, what are you doing? She goes, oh, we're treating her hypertension. I said, she's in pain. She doesn't have hypertension. We decided at that moment we would say, we would go to any length to get out of the hospital.
I just wish that one person would have asked me how I was doing mentally. Okay, you died and your husband had to rescue you. How are you feeling? No one even took the time to do that. They treated a patient, but they never treated me, the person.
So we got her home. And that was the first picture I took of her when she got home. And I stayed with her the rest of that week. And I'll tell you, sleep was not our friend that first week. What little sleep I got, I would startle awake, and I would just grab her to make sure, A, she was still there, that it wasn't a dream, and she really had died, and B, to make sure she was still breathing. And I'll tell you, even now, 3 years later, there's nights where I turn over and grab her just to make sure she's still there.
The nights after that, and in the hospital, not only feeling alone, but then at home, I would just lay in bed and look at the windows and look at the stars, and I was afraid to go to sleep because I was afraid that I wouldn't wake up again. And I already saw what I did to my family, and I just couldn't fathom ever doing that again.
Well, I think we also realized something too in the hospital, something about the difference between addiction and dependence.
So I think that this is really important as a healthcare provider that we think about this. So addiction is when you are compulsively taking medications, drugs, whatever that is, and you need to keep taking more and more and more. And you can't function without that. But then you also can't work, you can't be a family member, and it's weird to the point that it's very abusive. Where if you're dependent on medications, they're there to help support you through some sort of a condition that is real. And they're there to help you. Yes, if you come off of them really fast, you're gonna have withdrawal symptoms, but they're there just to help you deal with everyday life and function. The last thing that we did, so that took us a whole year to try to balance out all of these medications, but we did take a trip to the Mayo Clinic to ensure that we haven't missed something else that could be done. They confirmed the treatments we were doing, the medication regimen that I was on was right spot on, and really just reassuring myself.
So, a year later, December 14th, it was almost a year later, and I'm sitting in a meeting and we're listening to a cardiac arrest call at Costco. We only do about 50 cardiac arrests a year in our service, so I was listening pretty intently, and Anne keeps calling me. Finally, I pick up the phone, and she goes, "Hey, do you know what's going on at Costco?" I said, "Yeah, there's some guy there, he had a cardiac arrest, but there's some nurse on scene." I said, "So what are you doing?"
You know, babe, I'm just saving lives. I'm here at Costco. But little did I realize that that trip to Costco, that I thought would be nice and peaceful, quiet, none of my family, I could buy whatever I wanted, ended into something where I would be looking into the mirror as I was alongside a man that had arrested. That I would be going back and thinking, is this what I looked like when I arrested? Is this what happened? I looked into his eyes, and his eyes were staring off into space. He was lifeless, and he was dead. And it took anything and everything that I could do to go back to nurse mode and just do and manage the situation. It, again, was just so difficult because I kept flashing back and saying, is this what I put my family through? So I want to introduce you to somebody. I want you to meet Rex. Rex, at that time, he is my age, and he is married, and he had one child and another one on the way. He had just dropped his wife, Michelle, and his one-year-old off at the airport, and he came back to Costco to give this battery back to the center. He was feeling dizzy, so it reminded him that he better eat something. He also had these plans to go pick up drywall and then do his hour drive home. And then he was in Costco and went to reach for that bench in the food court, and that's the last thing that he remembers. So the Costco team, everyone did everything right. Within a minute, we had they started CPR, and AED was there. They cut off his favorite shirt. We did everything we should have done to make this happen. But it was that point that I found him, and I was at his side, assisting with everything. So, again, at this moment, and just recently, we were very privileged. I have stayed in contact with Rex and his wife, Michelle, for almost 2 years now. But that event was almost a year to my rebirth day. So I always keep going back and reliving that. But just recently, we were back at Costco, and guess who we finally got to see and meet in person? The first time I saw Rex, I couldn't do anything but just go give him the biggest hug. And I'm like, hey, bud, you're looking much better than the last time I saw you. But to see him now with 2 girls and his wife, laughing, smiling, just living life and being so just happy, and just seeing that true family being there, that was worth anything and everything that I could have ever seen or done.
So I want you to imagine if Anne had died that night. Would Rex be here? You never know the impact you'll have by saving one life. Would Rex's wife and 2 daughters have a husband and a father? I definitely wouldn't have my beautiful bride. Like I said, you never know the impact you'll have by saving one life. And if that had happened 1 more minute, or if I didn't wake up, this story may not have a happy ending.
This experience, it is with this entire thing, working with Rex, again, just looking into that mirror and seeing what my family went through. Why did this all happen to us and our family? There's And how are we just so lucky and blessed that Chris woke up that night and found me. But I want you to keep something in mind. You never know when it's your time. But if you had a second chance, is there anything, or maybe even one thing, that you might do different?
Thank you.
Get a hot.
Oh, yeah. So you're talking about Tracy.
Thank you guys so much. Thank you for allowing us to share our story. But there are two people that we really do need to recognize. First, I would like to recognize Tracy Loskar. Without her and what she could do with telling our story, she became, and she is my soulmate. She put down in writing in these articles something that I could never express. And she did such a beautiful job. So thank you so much, Tracy.
Yes. And we'd also, of course, love to thank Hillary. We wouldn't be here today without her support and her seeing the vision for what we could accomplish. And quite honestly, what she did for us and what Tracy did for us was very healing. I mean, there was a lot of emotion in our house the past few months, but I'll tell you, it was very healing. So thank you both very much.
Thanks, Chris and Anne. I'd like to introduce our final keynote address this morning, Dr. Ed